your invitation. In this talk, I will briefly introduce recent progress of AI application in non-imaging analysis in COVID-19. This is joint work with PVMAT. There are several clinical image modalities for non-imaging, including chest X-ray, chest CT, chest MI, chest PET, or chest ultrasound. Different image modalities explain different characteristics of anatomic structures or functional features of lung. For example, chest CT displays the staging of disease and confirmed lung cancer, and the early diagnosis of early stage lung disease. Nucleic acid testing is a gold standard for the diagnosis of COVID-19. Although the specificity is high, it has disadvantages of time-consuming and high false negative rate. Therefore, imaging examination has an important role in the clinical diagnosis and efficiency evaluation of NCIP. The fifth edition of the Diagnosis and Treatment Plan, announced by the National Health and Medical Commission, stated that the clinical diagnosis results of CT imaging can also be used as a criteria for judging the disease of NCIP. Thus, NCIP radiograph reading system is on demand in clinic. The system should include rapid screening prior to admission to judge whether the people is with COVID-19 image features. As a patient-conformed lesion location and classification models need to be built for accurate diagnosis and treatment evaluation. At last, NCIP follow-up module is also needed for providing data support and platform landing measures for epidemic prevention and control and epidemic tracking. We build a machine learning model based on algorithm for the diagnosis of NCIP. The whole diagnosis procedure includes 3 stages with 3 subnetworks for lung segmentation, lesion detection, and lesion-based disease classification, respectively. We can rapidly classify CT images of COVID-19 using the stage steps. For each input CT volume, we briefly segmented the non area using our previously developed multi-scale non-segmentation method based on deep CNN. The purpose of this process was to limit the lesion detection in a subregion to reduce the computation time as well as avoid false positives. Since labeling lesions for NCIP or similar cases in pixel level are time-consuming, the lesion location subnetwork is trained in 2 phases. In the first stage, we train the DCNN to distinguish the region of interest with the likelihood of NCIP into 2 classes, NCIPs or otherwise. In the second stage, we fine-tune the DCN to predict the case-based probability of NCIP by assembling the most significant location proposals. The last classification subnetwork training is actually included in the second training phase of lesion detection subnetwork. This is architecture of the proposed DCN. We can see the DCN is a pyramidal structure of network. and includes the three decode branches. The first branch is for the lesson detection. The second and third decode branches are for case level and ROI level lesson classification. The encoder and the first and the second branches are optimized in the first training phase. The part named CNET is optimized for accurate lesson level classification. The weighted dice loss and cross entry loss is used for the training of lesson segmentation and the lesson classification parts. In the initial training phase, a maximum of 10 NCIP candidate proposals were selected based on the ranked area resulted from target segmentation processes. These areas are ranked from the largest to smallest. The selected NCIP candidates were used to train the CNET iteratively. During the training, the candidate proposals were randomly selected from the first 15 proposals at each iteration. Finally, the case-based prediction is achieved by identifying a maximum of 10 proposals with a likelihood of NCIP lesson. So here is information of our data set. In this study, we totally collected 535 patients with NCIP. And also we have other disease like lung nodules or cancers and normal patients from hospital A for extract the lesion zone and then trained SVM to predict the likelihood of COVID-19 based on the segmentation. As the results show, the overall accuracy of NCIP and compared to other cases in test and external validation sets of NCIP net were 0.757 and 0.744. Here you can see that they were significantly superior than baseline method, the mask ICN. Here is our ROC analysis results. This figure illustrated the case-based performances of NCIP diagnosis in different data sets in terms of the ROC analysis of NCIP net and baseline. The first row shows the ROC curve of baseline, and the second row shows the ROC curve of NCIP net. This test the external validation and overall AUCs of NCIP net were over 0.9. Furthermore, we can see that there were no significant differences between three pairwise ROC analyses in NCIP-NET for different datasets. Thus, the results demonstrate the machine learning with limited training dataset also can achieve good performance in NCIP diagnosis. Based on the Cone NCIP lesion detection and diagnosis algorithm, we developed a clinical available NCIP radiograph reading and quantitative analysis system. This is a platform. On this platform, the lesion can be detected quickly and presented to user via intuitive and simple visualization tools and report forms. For example, with the three-dimensional rendering and visualization technologies, the non-organs and lesions can be presented more intuitive and clear. It helps the NCIP diagnosis more intuitively and thoroughly. We employed the MIMTT and vessel suppression for NCIP CAT. The arrangement and distribution of lesions can be clearly presented. The limitations and shortcomings of slice-by-slice reading can be remedied. Moreover, we also provide rapid progress and quantitative index analysis based on CT images in multiple phases. In summary, we can see that our analysis includes non-volume test, changes of average non-density, lesion volume ratio, image features. All of these analyses can be structured in a clinical case report. And doctor and patient can easy access to the analysis results and feedback of the latest situation. Moreover, we can also apply the big data analysis based on the NCIP diagnosis system. I think that it will help prevention and control the epidemic. Thank you very much.